Welcome to episode 1 of the Sickle Cell Society podcast. We're supported by Terimo, and today we'll be looking at the transition from paediatric care to adult sickle cell services. Now, I'm your host, Kesewaa, and I'm joined by sickle cell patients Michael and Bolaji. We'll be hearing from paediatric haematologist Sama Babaka, clinical psychologist Eliane Young, and haematologist Martin Besser. Now, I'm so glad to be here with you all and really looking forward to the conversation. Now, I want to talk about transitioning from paediatric care to adult care. And I know that can really disrupt the relationship between the child, patient, parents, and healthcare professionals. Now, I feel like this could lead to gaps in care and make transitioning tricky. So, Eliane, is this the case?
I think it certainly can be the case. I think it needs very careful thinking about with regards to the young person, with regards to their family, with regards to the paediatric team and the adult team. Young people transition in all sorts of ways. Some are moving hospitals, some are moving between different parts of the hospitals. So it's really important from very early on to start that conversation with the young person, to start it with their family and to think about what that's going to look like for that particular young person, for that particular family, to kind of troubleshoot very early on any issues that might come along with that. And to keep coming back to that conversation over a period of time and stretch that over into adult services, continue that conversation once they're in adult services, to really be thinking about providing best care and to continue the care for that young person.
That's really, really interesting. And I think one thing that really stands out to me is just how up until that point, it's parents who are making sure their child's care is adequate. But at 16, that's a lot of onus put on the patient themselves. And I'd love to know, what do you feel like can be done to make that easier? Or is there any steps that you take to try and make that transition a bit more smoother?
Absolutely, because the transition doesn't happen overnight, does it? You one day you're 15, the next day you're 16, bang, it doesn't suddenly change things overnight, does it? So we need to be thinking, quite early on, bringing young people more and more into those conversations, finding out how to have those conversations with them, to gradually be taking more and more accountability, more and more responsibility for their own care. And then, as I was saying before, to then pull that into adult services. So it's not, oh, now you're in adult services and we all kind of move away and the young person is on its own. So that scaffolding needs to come around the young person and continue through. And I think, transition happens at a time for a young person where there's so much else going on, kind of as you have alluded to. So there's other transitions going on for that young person, major milestones, whether that's exams, whether that's starting a new job. And so we've got to really think about what are all the other transitions that are going on for this young person, and how can we kind of really scaffold around all of that and really help them over a period of time to step into their care and take that responsibility more fully.
Great. And I know, Bolaji, you've been on the different side of this kind of relationship. You've been a patient, and I'd love to know, do you remember what it was like when you were a patient transitioning from paediatric care to adult care?
I do. It felt quite turbulent, I'd say, just because obviously the paediatric side is all you knew. And then one day the doctor's like, we're going to have to move your care to adult care. It's like, that's the best way to describe it. It's like you're in a club, your favorite song's playing, and they cut it halfway through and you need to leave the club. That's literally how it felt. I was getting dragged away from this almost safe haven of the children's wards, should I say. And I had to move to being an adult. And obviously at 16, you don't really feel like an adult. So it's like this whole transition and you're not really ready for it. And your parents aren't really necessarily ready for it either. So it's like you're looking, obviously, at the time, obviously, I was raised by my mum. I'm just looking at my mum for the answers. But she's obviously none the wiser, and she's going through this transition with me. And it was just one of those things, I remember it just very vividly. And I didn't want to leave where the children, is it pediatrics? I didn't want to leave the pediatrics ward, but obviously it's determined by age. So I didn't have a say. It's just how things went. So I kind of understood that my care was in my hands and I needed to really be an advocate for myself. As much as the doctors are there were all of these new doctors that I wasn't familiar with. So I just thought, this is just me by myself, and if I need to talk to my mum, I'll talk to my mum. So it was an interesting experience. Obviously, we got through it. It was fine. But as you were saying, I think it can be smoother. But in terms of drawing up ideas, I don't know how it can be any smoother. And I think it's quite important that the children, or the child, in my case, me, does start taking responsibility for their health, because it's my health and I need to know what's good for me, and not just look to others to find that out for myself.
Yeah, I understand what you're saying there entirely. And I feel like you kind of alluded about why you didn't really want to move from pediatric to adult services. And I'd love to know, could you elaborate a bit on the reasons why you were a bit hesitant, or you didn't want to move from pediatric to adult services?
So I was kind of like a late bloomer in terms of my sickle cells. I got sickle cell when I was 10. And obviously I've had sickle cell traits in my blood, but I only really started to affect me from 10. So from 10 to 16, those 6 years at King's, that just felt like home. And you knew, like, the doctors knew you, and they knew your kind of your journey as well. I think the journey is quite key here as well, because whatever you've been through, they know about. And when it all shifted and changed, I just thought that the information passed over those 6 years were going to be lost in translation or transition in terms of the adult ward, should I say.
Michael, I'd love to know, did you feel similar to how Apologies what he's been describing?
100%. Like with me, since I was 4 years old, I started having transfusions. So I was in the pediatric care since I was 4 years old. And obviously, from 4 years up to 16, you build really strong relationships with, the healthcare professionals there. So I had really close relationships with who was looking after me. I remember their names, Sharon and Natalie. They really looked after me. And obviously, because obviously when you get transfusions, they have to put needles inside you. So they knew my veins really, really well. And they knew what worked for me, because I hated taking needles, but obviously I had to do it. So they knew what worked for me. However, that transition to adult care, someone who doesn't really know you, someone who doesn't really know, your veins, who doesn't really know what works for you and what doesn't, can be really scary. And obviously I remember when I was 16, everything was going downhill, because I was doing my GCSEs, and then I was told that I need to transition, with people that I, basically like family to me. So it was really, really hard. And I remember when I was actually 16, everything was becoming too much, and I actually had my first crisis. And that crisis was painful. So I was in the hospital for, a long time, and, balancing, I had to balance that with everything that was coming to me. And, it feels lonely, sometimes you feel like you can't speak to anyone. But, it's a really hard transition. But, luckily I did have the support there. But, I just wish that, it was provided, earlier, I would say. So like they took me down, explained it to me. Okay, this is going to happen. Everything just felt a bit rushed. It felt like I was just thrown in a deep end. And, I don't know if that's the case for a lot of people. But I feel like now things are starting to change, things are starting to improve, which I'm happy about. But I feel like for me, it was hard and difficult.
Well, thanks for sharing that. I really appreciate it. And Sama, obviously as a paediatric hematologist, I want to know, is this something that you hear often? Is this like a common theme or common occurrence?
Most definitely, yes. There is a lot of things happening at that age. People are going through social changes, physical changes, even changes with their sickle cell disease itself. The way the crisis happens, how they respond to it is a bit different from being a child. And of course, there's so many other academic work experiences. Everything is changing. And having to go through an experience where you feel like you're thrown into the deep end to the unknown, essentially, is quite scary. And we do hear that often because of lack of maybe staff, lack of appropriate support. But we are trying to do a lot of work to improve that, to try and get people that will be there across the transition process from very young age towards even beyond transition into the adult services. We're trying to introduce the idea in the clinic quite early to say, okay, you're 12 years old, you're 3 years old, 13 years old, but we would like to talk to you today. And your parent is at the side, they can help you. So self-advocacy, as you were mentioning, is very important. Adolescents need to know that they are the experts in their condition, and we need to encourage that from a very young age, because otherwise they'll go to the adult A&E. People will say, what have you got? What works for you? And they don't know. So I think it's very important to introduce the idea of self-advocacy very early and ensure that these patients know that they are the experts in their condition and they are prepared early enough. I think early preparation is important. Introducing the idea of transition from the age of 12, 13 is quite key because it's a gradual process. It's the continuum. It cannot happen overnight, and it could be quite disruptive if it does. Yeah. So I'm really sorry that's your experiences, but we are trying to improve that by making some changes.
Great. I mean, that sounds like that could definitely have a positive impact, from age 12 or 13, having the patient kind of talk about themselves and, have their parents be at the side or be second. That sounds like a great thing that you're implementing. And I'd love to talk, about the access to adult care following on from that, because I know that a barrier to accessing adult care can also be just how far adult services are maybe from the paediatric services, from where patients live. And I know that, Martin, you've probably experienced this, or you know a bit about the challenges about this. So I'd love to know, how can we help navigate this? How can we help young people navigate this and navigate their condition on their own terms and, in adult services?
It's a very difficult and unfortunately partly unresolved issue.
Okay.
We realize it's a problem. We're trying to get better at it. And it's a huge challenge. The pediatric networks are different. So if you're lucky, your adult and pediatric network will be the same, so the same hospital at least. But not everyone's that lucky. The pediatric services are more centralized. So not infrequently do you find that your adult service may actually be in another hospital, maybe even in another town. Or even your specialist center could be quite a bit away, so in the other direction from where you are. For instance, for us, some patients are with us when they are children, and the adult specialist center may be as far away as Leicester if they live on the edges of the service, which of course it may be a town you've never been to, and that's potentially quite tricky. So a lot of people prefer to at least stay in the same hospital with the same concern about records being lost, and at least there's some sort of continuity in terms of access to the records. And for us, we realize the patients are at a very difficult stage in their life. They may only have 2 or 3 planned visits with us before they're off to university, moving away from family and friends for the first time and needing yet to find another hospital. And there's a lot to learn, and you sort of have to pack your suitcase with the right medication, your treatment plan and everything else, and choose the right university where you can access specialist services if you need them. So you're able to meet those challenges. And we realize these are huge problems, and it's work in progress for us. We realize we're not giving you enough notice, enough warning. And for us on the adult side, we would love to reach you sooner, I guess, and have an input earlier, even before you move, so you know where everything is. So we're trying to signpost you when you come, in terms of these are our nurses, these are our units. We take you to the specialist treatment areas for adults, and we also leave the door open that if someone has a traumatic time, that we will try and allow people to go to the pediatric ward, provided they're not 20 or 21 by then, assuming that it's still sort of within the time frame around 18. And we also have a teenage young adult ward, which can be a help, but of course it doesn't always have capacity at the time. But quite a few people in your age group really like the teenage young adult ward as a really nice halfway house, because they may recognize some of the nurses there, some of the doctors, yet it's an adult place, and it's different, but not quite so different as a normal hematology ward would be.
Obviously you said, that's a work in progress sort of thing, and it's something that you're trying to resolve. So I'd love to know, are these steps that you mentioned just now, do you feel like you're starting to see maybe some improvement for some young adults?
So we are aware where our problems are. So I would say we are more prepared where things can go wrong. But I would say that we have a lot to learn still from our patients, and how to work better together, especially with the fragmentation if people come from the edges of the areas that the pediatric service is looking after, how to make sure that if they've had care locally and centrally, how the local areas can follow suit, because that's yet another transition which maybe needs to take place, and over which we have less control over, how you would go from the pediatric ward in the hospital in your hometown to the adult hospital in your hometown, which is yet again different from the specialist review where I work.
Of course. Yeah. Thank you for sharing that with us. And, Sama, I'd love to know, as a pediatric hematologist, is this something that you've noticed as well, or are there things that you're putting in place to maybe make the transition a bit smoother for those, pediatric patients going to adult care? And when it comes to distance, have you noticed similar?
Well, first, the goal is to have as seamless transition as possible. So as I said, starting early, having the introduction of what we call is an assessment tool or a passport to assess readiness for transition. We look at things like knowledge, skills, and even life skills, general life skills, rather than just only health skills. We start early. We start at the age of 12. Then again, we assess at the age of 14, and again at 15 and 16. But what measures we could put in place is, I think, clear communication. We have to be very clear in what other teams are looking after this patient. We are hematologists. We look after the patients in the hematology clinic, but this is a multi-system disorder. A lot of the patients are known to other teams, whether it's the kidney doctors, the lung doctors, or any other team, even in the local hospitals. So I think very good transition requires very good communication with all the teams looking after these patients. So let's say we have a patient that's looked after in a local hospital closer to home, and we are in the process of transition. We need to communicate that this is what we've done. They're expected to transition at this time, and when they have transitioned, to make sure they're linked in with the local adult services as well. And then similarly, services at tertiary level, for example, in the main hospitals, if a sickle cell patient is looked after by the brain doctors or any other kind of team, we need to ensure that communication does happen, to say, okay, they will need further input from these teams when they're in the adult side. So I think clear communication between healthcare teams is very important to ensure that we are not missing opportunities to give them the best holistic care possible.
What I've understood there is that communication is key. And you mentioned a passport, and I'd love to know, is there any way you can summarize what this kind of sickle cell passport is in a sentence or two, and maybe detail what's on it as well?
There are different methods of assessing readiness for transition, and I just want to say that when the people are assessed for transition, it's not their chronological age. Like you were saying, that when you're 16, it's on automatic, almost transfer to the adult service. It's not meant to be like that. The chronological age is not meant to be what determines whether you go to the adult services or not, is whether you are ready or not. And how do we find out if a person is ready? Is by assessing that. There are so many different ways. In the UK, people use the Ready, Steady, Go format. At Evelina, we use the Sickle Cell Passport. So these passports are essentially documents or a series of questions that are scored, for example, from 0 to 10. And they would assess the knowledge of the young person. Do you know about sickle cell disease? How does it work? How does it affect your body? Do you know what medications you take? What are those medications for? For example, penicillin. Do people understand it's an antibiotic? Or maybe hydroxycarbamide. Do people understand why it's important to take these medications daily? So it's important to assess that. But a lot of the other things assessed in the passport are just self-advocacy, self-efficacy. Do you think, in a situation where you need to tell your friends, for example, because that's a big problem that does come up for young people. Are you able to tell your friends you have, pain? Do your friends even know you have sickle cell disease? And then there's a section about academics, how to manage pain around studying, trying to get ahead, trying to be like peers. There's a section about social life, because at that age, people are exploring. They want to do other things, maybe things like habits that people can pick up, like smoking or alcohol. So there's a section about that. There's also a section about sexual health. And it's important to be aware of these things, to talk about it early, so it's not something difficult to address at that age. So these passports are very important in assessing readiness. And it's important not only to us. So when we assess readiness, we have to identify gaps. So if we do a passport at the age of 13 and we identify a gap in knowledge, so then that's a target for us to say, this person does not know very much about their condition, now we need to target that and fix it. So I try to make it very, very person specific. So other people will know everything about sickle cell disease, but they have absolutely no idea about how to manage their pain. So they know how it works, why they get pain, but they don't know what to do if they get a crisis. So part of that would be, take your medications, drink a lot of water, keep warm, all of these skills that need to identify the gaps in the skills and addressing them very early on.
And I'd love to know, Michael and Bolaji, is this something that you considered when you were transitioning from paediatric care to adult care? Were these things you were thinking about?
Yeah, 100%. All I can say is, where was this passport when I was there?
I could have
it
done
was
that
there.
passport, but it's one of those things, obviously, we're here to make it better, and as time goes on, the care will become better. And that, obviously, the passport idea is a great idea.
Yeah.
And just things like the medication, as you discussed, people, or when I was growing up, certainly, I didn't actually know what the medication was doing. So there would often be times where I'd be inconsistent in terms of taking my medication, but the knowledge behind it and knowing that the penicillin is an antibiotic and it helps your immune system fight off any bad bacteria or colds or flus or whatever it might be. That type of knowledge, like, younger kids need to know, which can then obviously prompt them to take those medications on a more frequent basis.
Yeah, 100%. I agree. And, even when I was 16, like, the lack of knowledge, I didn't really have, understand my condition. Because, growing up, I never had a crisis before. I was just go for my transfusions, come back home and everything. Like, I could do everything normally. So I didn't really have the knowledge of, what sickle cell is, how it affects me. So when I had my first crisis, it was obviously, I was stressed out. I was 16, doing my GCSEs, doing the transition, being introduced to the transition. I had my first crisis. Sorry, I'm just going to give a quick story, So I was it was in the nighttime, and obviously I had an exam the next day. And I started to feel pain in my lower back, and I didn't know what it was because I didn't have the knowledge. So I just thought, you know what? It's not just me going through it. Everyone's going through it. Everyone is stressed. Everyone's probably, having this type of pain. So I was, I got up, I started walking around. The pain started getting worse. And then I just thought, you know what? Let me just try and man it up. And then I would literally start doing sit-ups thinking, you know what? Because it was in my lower back. So I just thought, let me just try and do sit-ups and see if I can get rid of the pain. But the pain was so severe. Until I went to the hospital, they explained to me, you had a sickle cell crisis. This happens when you get too stressed. You need to make sure that you understand your condition. You need to make sure that, you're taking breaks when you need to take breaks. And, stuff like, knowing that I had extra time, I didn't know I had. So I feel like, understanding your condition, making sure that all the people who are important, like, schools, other people who affect your life, know about your condition. So that they can help you, because the support is there. But people don't tend to. Well, I didn't, know that the support was there. So I learned the hard way.
Do you think it's got easier over time, explaining to your support network about things maybe that you can both put in place, them and you, about when you're in pain and what they can do to help? Has that got a bit easier, would you say?
Yeah, 100%.
Yeah, I'd say so. I think sickle cell, it's being talked about more frequently, so people are kind of opening up to the idea of what sickle cell is and how it can be managed. I think there still needs to be some more done in terms of raising awareness for sickle cell. But it's becoming an easier conversation to have, which is obviously the step in the right direction that we're trying to take.
Yeah, 100%. And even I was actually invited to speak to, younger kids who are actually going through the transition. And I feel like events like that where, someone like me who's been through the transition from pediatric to adult services, someone that they can relate to who's been through and they can give their experience is really useful. And, after after I did the talk and explained to them my how it was for me transitioning, they received it really well, and they were asking me a lot of questions. And afterwards, a kid came up to me and he said, thank you for giving your talk. It really helped, and that really sparked something inside me, saying that I do have actually a will to change things, or give my experience to help the society. And events like that, it really helps. So I just feel like coming together as a community, just speaking, relating to people who have been through it, and speaking to just the conversations needs to be had more, I would say.
So I understand what you're saying entirely, and I just think there's so much in the mix there. You're young, you're hormonal, there's like puberty, there's just all sorts going on, especially when you are at that age. So Eliane, I'd love to know, like, what's it like for the patient and the parent to go through this process? How would you define it? What would you say it was like?
I think that's a really interesting question, and I think it's really great to bring in the parents at this point too, because young people are firmly within a family system, aren't they? And it's not just the young person going through this transition, through this change. It's the parents as well. And I think, particularly if they've had a good experience of paediatric services, there's going to be a great sense of loss. There's going to be a real felt sense of change. And I think there's very few people out there that do like change. And then there's going to be this huge challenge then of rebuilding new relationships with your kind of new healthcare team, building back up that trust. I was really struck when these guys were speaking earlier about feeling that their paediatric team knew them. And so I had a real sense that they felt safe. And so then it feels like there's a risk then going into a new team. Will they see me like this? Will they know my history? Do they understand what's right for me? And so I think it's really quite key in order to keep that sense of feeling safe and feeling held and feeling known going through, which is why those relationships need to start, I think, before the transition happens, so that when the young person kind of moves into that new team, that sense of being held is still there. And I think we also know for young people, kind of as you were talking about, there's so much else going on at that point. And we know kind of mid to late adolescence is a really high risk time for emotional wellbeing difficulties, for mental health disorders, so really got to keep a broad sense of what the challenges are and what the emotional experiences are for the young people going through it. I think we also need to think about the parents and the siblings and the wider family going through this too, because it's a real challenge, I think, for everyone. And if we think about the parents going from feeling like they've potentially got a really good grip on things, that they're totally in control of things, and then they've somehow got to navigate and negotiate with their child, that kind of changing position that both the child and the adult are going to take as they go through this process. And people when people are learning new things, they kind of have to get it wrong a few times. That's how we learn best as well, isn't it? And so the parents kind of have to be able to withstand that, tolerate that, still allow the young person to kind of flex and grow into that new position that they need to take in terms of themselves and their health and their well-being. And I think, it's fair to say that with that probably comes some conflict, doesn't it, between parent and child, and about how you navigate that and how you work that out. And I don't think it's necessarily a linear process either. I think, sometimes a young person needs the parents more, sometimes they need them less. They might be winning with some part of it at some point, but then may need parents or other family members to step in again. It's something that maybe they had a grip on before. And with all of that, as you're kind of asking me, comes this kind of a little bit of an emotional kind of roller coaster at times, this emotional journey. And so it's really important to do that all mindfully. And I think it kind of comes back to communication again, doesn't it, with your healthcare teams, with your parents, with your siblings, whoever it is that's involved, and to keep asking the question, right now, are we getting this right? And that will be a dynamic, ever-changing process, I think.
Yeah, no, that makes perfect sense. And I know, Sama, you're obviously a paediatric hematologist, so I feel like your angle may be a bit different, or you're in a different position when all of this is happening. And I'd love to know, is it easy for you? Do you feel like, is it do you feel like when your patients transition to adult care, like the ones that you have a really great relationship with, is it difficult saying goodbye to them?
Oh, yes, 100%. It's always difficult, but it's always much more rewarding if you know you prepared them well. You know they'll go to the adult center and they'll be very well and they'll advocate for themselves, they'll take their medications, they'll be well. And all we want to know is these people are going to go and grow into incredible adults, have incredible careers, fulfill their lives to the full potential, and not allow the lack of preparation ruin that in the adult setting, because we know that a very effective transition can lead to a very well-balanced sickle cell patient in the adult service. People can really do whatever they like if they are looking after themselves, if they have the right support in place. So that's what we're trying to achieve. It's very difficult to say goodbye, but it's also very rewarding to see them grow into incredible people. And that's the whole goal. Letting go is a problem for the clinicians, but also letting go is a huge problem for parents. I just wanted to comment that for the parents, it's quite difficult to just let go of the responsibility. People spend 16 years with a child that goes to hospital, have appointments. They are in charge of everything. So we see them and we do the transition passport, we do all the preparation, but we also try to transition the parents to say, please encourage your children to be in charge, encourage them to look after their own health, and do simple things. For the older people, like 14, 15, we say, allow them to start practicing, do very easy, simple things like requesting a GP appointment or requesting a refill of a prescription, basic life matters that could actually be quite complex if you have never done them before as a 17, 18-year-old patient. So we need the parent support. We need them to transition with the patient, and we need them to also, push a little bit and let go to help these patients be, the best they could be.
Of course. And I feel like at 60 and you're still so young, I feel like to a parent, where no matter how old you are as a child, you're always going to be your parent's child, at like 27, 30, 35, do you know what I mean? Yeah. So I can imagine as well that it's not easy for the parents, is it, just to take that step back?
Yeah, absolutely. It's important to get the support from all the angles.
Of course. And, we spoke about it quite extensively when it comes to education, such as the passport or the other systems that are in place to kind of empower the patient on their transition. But I feel like one word that's always mentioned when it comes to sickle cell is education. And not only do you have to educate yourself to navigate this kind of new unknown process, there's just such a huge difference between adult care and pediatric care. And Martin, I'd just love to know, we spoke about resources, we spoke about education, but how important is it to you that families kind of familiarise themselves with resources that are available, and how can children advocate for themselves within the adult healthcare space?
It's extremely important because whereas the pediatricians are very prescriptive and very good at chasing up missed appointments in the adult world, if you don't come for your appointment, you're back at the back of the queue. And I think that comes as a bit of a shock to many people, how little help you get with keeping appointments. Being 17th in the queue, waiting for the GP to pick up the phone for your repeat prescriptions, all these things are big factors. I mean, it's very difficult. We find it with the first appointment, usually the parents still come, maybe with the second appointment, and then with the third appointment, sometimes the patient themselves don't come anymore, or they will book a telephone appointment that they're then not available for. And it often drives it home that maybe we should have done more to prepare them for this, of how difficult it is to catch up with appointments that you've missed. And not infrequently, similar things happen in dentistry. They often lose their dentist as they move cities, and you often feel, I wish we'd spend more time educating. So education is key. Also asking questions about the bits maybe you've never been taught. So we've been doing some patient education days at the moment for adults, actually, because we realized lots of people all their life have never caught up with it, or maybe they've forgotten, and no one's taken the time again to tell them very basic information, how to take your painkillers, what's the penicillin for. We just assume, it's penicillin, they will know what it is. Like I say, it is work in progress. We know we need to do better. Our nurses make a big difference, so they take a lot of the education on board, and they do the initial tour. But maybe we don't talk enough about how easy it is to fall between cracks and be lost to follow-up, and how important it is to tell us when you can't make an appointment, and to actively try to not have these appointments too far apart, which is a very big thing after the pandemic recovery. And in pediatrics, I think that is still better in terms of not being able to be left behind too long before somebody takes initiative and chases you up with whether it's through safeguarding or lesser means. That is all much further down the line in adults, and we don't do enough of that.
Well, thank you for sharing that with me. And I'd just love to know a bit more about the education days you mentioned. What will they entail? What sort of things will you be teaching patients?
We called it the pain day, but of course that's probably a misnomer. We will talk a lot about how to deal with pain with things that are not medication. We'll talk about disease modification. We'll have a pain physio there tomorrow, so that should be good. We have a dietitian. We're trying to find out what people know, what they don't know, and it's all about dialogue as well. So the last day we did, the biggest thing was actually getting people to talk to each other in the room that had never met each other, very different backgrounds, whether they've grown up in West Africa or grown up in the UK, and sharing experiences and also trauma from childhood, what it's like to be the person with the chronic illness in the family, and where the shortcomings are that we can maybe help with that are not medication. There's sort of this dilemma between the obvious symptoms, which are pain-based, and we are too focused on pain in our sickle cell care, and how to deal with the silent symptoms where people also have needs and maybe nobody has ever addressed them. So it's both for us to learn from the patients, and for the patients to hopefully learn from us a little bit how to manage at home better, and how to come earlier rather than later when they're not managing. So when to spot that you're not winning. So that's maybe the bit that we'd like to bring home.
Great. And now you touched upon shared experiences just now. And I know that Michael and Bolaji actually did meet on a ward. They had that shared experience of being in the ward, and they met there. And, touching upon what Martin said about education days, I'd just love to know, where did you think you got the majority of your education from when you were transitioning? And I guess, how important is it for you to have each other as you navigate life and go on this journey?
It is quite important. Obviously, I'm a little bit older than Michael, I think by 10 years. And obviously, like, we can talk in terms of things that he's currently experiencing that I've probably been through. Shared experiences are key, because you have someone to kind of walk you through what's happening to you. And as much as you can speak to your parents, to the doctor, they don't actually know what you're going through at that point in time. And just the familiarity with someone that shared that experience with you is so comforting.
Yeah.
And I think obviously, for us, we were very lucky to find each other on the sounds like a relationship to find each other on the ward. But like, it was key, because obviously we can talk through how we're being treated as well. I think that's key, like how your treatment is, whether you like the nurse or you don't like the nurse, or have they taken too much blood from the wrong places. Like, all of these are key learnings for us, and it like helps us deal with obviously our side of our sickle cell, and we can kind of compare notes and be like, that's not right, that's right, this is what we need to do in the future, type of thing. And I think obviously Michael has a different perspective from me, but I'll let Michael.
Yeah, no, I completely agree. I feel like, speaking with someone that has, the condition and has, been through the same experience that you've been through, like you said, it's really comforting, because, you just get to, really speak with them, understand them. And there's just that, I don't know how to explain, it's just like an automatic connection that's there.
Yeah.
Just because, you both know how everything is, you both know what type of pain, what type of sickle cell pain you go through.
Yeah.
And like we both had a sickle cell crisis, and we met on the Samaritan ward in Guys, and funny enough, from there we kicked off, and we stayed in contact. Yeah. And I believe is really essential to have that that type of connection, whether that be events where you get to network with people and just get to speak with someone who's been through what you've been through, because there's different types of people go through different types of sickle cell experiences, and being able to get that out and compare and link, I feel like it's important.
Yeah, we're often like named sickle cell warriors, and it's funny to me because obviously, like, when you are dealing with sickle cell, it does feel like a fight, and to know that you're not in that fight alone and you have people to relate to and to talk to, and know that you're in the battle, should I say, with someone beside you, it's so beneficial. And I think obviously I would love to share my knowledge in terms of how I've dealt with things over the years, with a wider group of sickle cell warriors. I'm going to start calling them warriors, just because I know it helps, and obviously speaking to Michael, I know it helps. So the more we can share, the better.
That's so lovely. Honestly, it's really, really important. And from the educational aspect, we've heard a bit about how health professionals are trying to make sure that people who have recently transitioned into adult care are clued up, they have the right information on what to do. And I'd just love to know, do you feel like when you were transitioning from paediatric to adult care, do you feel like there was enough resources for you? Like, do you feel like you understood what the jump would be and how big it would be?
I feel like for me personally, all I can say is they tried. I could see that, they did try to really, prepare me for it. But for me, I felt like it wasn't enough. Like, I didn't really understand. I felt like, I didn't really understand why I was transitioning. Being that young at 16, I didn't really know why I was just transitioning. And, like, it was just so abrupt. So I feel like, going through it myself personally, it was hard, but after the transition did happen, the support is there, and once you get used to the new team, you really start to settle in, and you go from there.
Yeah, just to touch on that, the information was there. I think the hard part is making it digestible for a 16-year-old. Like, at 16, my brain was going through a million and one thoughts, and for me to then factor in that type of sickle cell information, because it is quite a bit, and to understand what's happening, I think the more digestible it is, the better for us. That way we don't feel that we're lost or we're not informed on what's actually happening at that current time. There was like a lot of leaflets. I remember there being so many leaflets, and it was just like, I'd rather play on my PlayStation when I'm 16 than read that. But things like, obviously, kids taking information differently these days, and like podcasts and YouTube and whatever else platform they're on, TikTok, just bite-sized bits of information, I think is the key to kind of upskill them in terms of their lack of knowledge of sickle cell.
Yeah, and even recently, just all of these events that's happening now, that I'm starting to notice, like, they're doing, more meet and greets, more meets where you go to the hospitals, where you're transitioning to, you get to see the team, you get to walk around the whole ward. And I feel like that is really essential. You get to, live it before you actually live it, if that makes sense. So I feel like all of this that's being introduced now is really, really effective, as I've seen. But yeah, that's what I'll say.
Great. And I would love to know, for the healthcare professionals in the room, digestibility, is that something, Sama and Martin, that you've thought about when you've put your resources together?
I think it's very important because, as both of you were saying, the information is there. The leaflets are there. You can look on the internet, you'll find it, but making it more understandable, more appropriate developmentally for that age is very important. Utilization of videos is great because I think the current generation is very visual. People would rather watch a video than read a leaflet. Utilization of things like mobile apps. Everybody has a mobile app now. Having an interactive mobile app that could explain things would be very helpful. One of the things we have been doing, I think what Michael has referred to, is a transition workshop. So a workshop that's dedicated for transition preparation. And Michael kindly came and spoke to the young people, and I'm just echoing what he said. The feedback was incredible for his part because, as you were saying, hearing it from somebody that already has walked through that path is very different from a doctor or a nurse just explaining things. So that's very important. And then other things, we need to make it more digestible by breaking it down. So explaining to a 12-year-old is not the same as to a 14-year-old, not the same to a 16-year-old. So making it easier to understand is very important, making it more digestible and making it not sound like a very, how do I say, a very detrimental thing. So in the workshops, we try to make them more interactive. So the one that you did attend, Michael, we tried to make the sessions interactive, making it a bit more fun, not very serious, because at this age, I mean, the last thing you want to go to is a lecture about sickle cell disease. You want to know how to improve your health rather than just hear facts about the condition. So it's important to ensure that we incorporate all measures possible to make it very appropriate to their developmental age.
Thank you for sharing that. And Martin, I'd love to know if digestibility is also a factor that you've thought about, and it sounds like you are considering, but I'd love to know hear it from your own words.
Okay, sure. So we haven't always been an SHD, which is the middle level of hospital care provider for sickle cell, and with us becoming that middle level up from the lower level, we developed this big information pack of leaflets. But I'm not sure how much of that gets read and how systematic people work through this, and particularly with how to take your painkillers. I've recently started to make some short videos exactly for that, which I think it sometimes it cuts through and allows the patient to take that in. And I often use it in the middle of the consultation while I fill in some paperwork. I get them to watch a 3-minute video, and it's surprising how many people have never been told. I never had a visual thing about how to take your medication, and it works much better than a leaflet. Obviously, some things you should really give as a leaflet because you want to go back to it again, and maybe it's information you need for later use, which would be difficult to find again as a TikTok video. But I think at the right time, it can really be an icebreaker and allows you to talk about things and maybe get to the patient in a way that they've not been approached before.
Okay, so we've spoke at length about transitioning from adult care to paediatric care, but I'd love to know, I guess, what does this transition team look like? And also, what's the difference between the team in the paediatric services in comparison to adult services?
Thank you. Yes, that's a good question. I think it's very important to always remember that transition is a process, it's a continuum, and it does require a multidisciplinary effort. So for example, what we do is we have a team that's got a pediatric doctor and an adult doctor, a pediatric nurse and an adult nurse, and also a pediatric psychologist and an adult psychologist. So this is the team that's around the young adult at that time to give the maximum support possible. So this team would coordinate the transition of these patients, seeing them in what we call a multidisciplinary team clinic, where we address all the gaps that we have identified through the transition process, assess how ready they are, discuss what's going to happen in the adult clinic, how does it look like in the adult services, what there's differences in emergency care access, what there's differences in the clinic setup, and also talk about self-advocacy and improving independence, all of these things. It's also, I think, in my opinion, very valuable to have a transition nurse or a transition coordinator. We've recently been able to appoint a transition nurse, and she's to start very soon. So I think that person is key, and again links into making education more palatable or digestible. Having a person that is the named transition nurse or coordinator from a very early age on is much easier for the young adult, because this is a relatable person. They are there the whole time. They know they'll be there even beyond transition. And we always say that ideally the transition period should be defined between the ages of 12 and 24. So it shouldn't end at the age of 16 or 17 when the person is in the adult clinic. It should continue beyond that so that they continue to gain more skills and more independence. So having a multidisciplinary team, having a named coordinator or a nurse is very useful in my opinion. And I think it's not, unfortunately, not able to have this everywhere the patients are, but it should be something we strive to have.
That's really interesting. And like you said, it's not somewhere that is everywhere, unfortunately. So I know that could maybe be a bit distressing perhaps for a young person who's transitioning to adult care. It could be maybe a bit distressing to be around people they've not met before. Yes. You know, they're moving away from their team who knows so much about them, about their needs and what's best for them. And Eliane, I'd love to know, when it comes to the emotional and, you know, mental part of transitioning, what are the challenges that you've seen and what have you been presented with?
So I think there's a lot about what you've just said there, and also bearing in mind that transition in the context of what else is going on for that young person. So, there's huge challenges that come along with switching teams in terms of making new relationships, in terms of taking more responsibility, in terms of learning what you need to learn. And with that can come a lot of anxiety, can come a lot of fears about your health, fears about the future. How will I take care of myself? How will this team take care of me? How will I have the conversations that I need to have with the people that I need to have them with? So it's not just to kind of your immediate MDT. It might be with A&E staff or with ward staff. And the burden of living with a long-term health condition, in and of itself, can feel really heavy, and can feel really isolating, which was lovely to hear you guys talk before about the connection that you felt in understanding each other, and that kind of takes you away from that isolated position, I think, of feeling it's all on me and I'm on my own with this. And I think if we think about then, the stage of life that these young people are at this particular point in their lives, and how they're also grappling probably with puberty, peer relationships, trying to, make some quite significant decisions about what their next steps are in life generally, trying to find their way in their world, their place in their community. It's a lot, isn't it? And I think, young people are very susceptible, particularly at this point, for feeling low in mood, for feeling anxious, for feeling fearful, for feeling overwhelmed. And so it's really important to pay really sensitive attention to the emotional well-being of the young person going through, and to very directly have those conversations, and very carefully unpick that with a young person about how they're feeling, and very specifically what's going on for them, formulating that, understanding that, paying attention to that, and seeing what might be helpful specifically for that young person at that point.
And jumping off that, Michael and Bolaji, we were discussing that you met on the ward and how there's a bit of an age gap between you both. Bolaji, you're a bit older than Michael. So Michael, we know that obviously it was an isolating experience for you, but you had, Bolaji to look up to there. But I guess Bolaji, I'd love to know, what was it like for you in that experience when you were transitioning what was it like mentally and emotionally for you?
Mentally, I was, I guess, anxious, I'd say. I had a lot of questions, but internalized questions in terms of how am I going to face this by myself type of thing. And it always goes back to that thing, like, because you're a man, you have to kind of like man up and just put on a brave face type of thing. And I think I definitely went through that and thought, I'll be all right. It will be all right eventually. So it was a tough transition, but I think obviously my family support and network was definitely helpful in that time frame. And obviously, but not everyone has that. So I count myself lucky to have that. So my friends and my family, I'd say uncles and aunties as well, they definitely helped within that transition. So I was very lucky. Emotionally, you have all this built up, I don't know, aggression and questions. It's all a mixture of things, and you're trying to find ways to an outlet, should I say? And you don't necessarily find it, but you kind of from there. I think that's when I kind of took the onus on myself and took responsibility for myself and said, I need to make sure that I understand my health. So I think it's almost like a bird out of the nest. You get kicked out of the nest, and you kind of, it's sink or swim type of thing. And I think you have to swim for yourself and for your future and what you want to do with your life as well. It's kind of like the toughening up period. And with that came with its own challenges, and there were some nights where I'm just like, I can't do this by myself. I don't think I can do this full stop. But when you are faced with that, you kind of go on Google and stuff. Google's probably your worst enemy there. When you're trying to find the answers, I definitely don't recommend going on Google. But you kind of like, obviously for me, I kind of live by like a health rule. I always try to eat healthy and train healthy. And that's kind of like how I learned how to manage myself. So the right foods, like things like beetroot, I didn't even know beetroot was so good for a sickle cell patient in terms of what it does for the blood. Like those little things, I was kind of happy that I kind of found out the hard way. And things like water, like I drink like 2 liters of water minimum a day. Like just having enough liquid in your body is so beneficial as well. Obviously I don't want people to go through, or young kids with sickle cell to go through what I went through the hard way. I'd love to share that information. But I think it's just how you use the emotion and the pain, the hurt, and how you can turn it around into a positive. I think that's crucial. And I was obviously lucky to be able to do that. But for people and kids out there that don't know how to do that, I think like this is a great outlet in terms of finding out that information for themselves. And asking the right questions as well. That's very key. Knowing how to answer the right questions, so let's say, because it just leads you on to another path that you need to go down.
Yeah, I think it's both really interesting that you've both mentioned this notion of like manning up. You've both mentioned it, and I think it's such a, there's so much we can talk about there. But I think it definitely doesn't, the fact that you're from African Caribbean background, or people from African Caribbean backgrounds, I definitely think it's much harder sometimes as well to deal with those emotions sometimes, and just kind of process them. Do you know what I mean? Because there's always an expectation to be strong, and that being strong is also admitting that you need community, you need someone to come help you. You know what I mean? So I love the emphasis of community that you've both kind of displayed and spoken about. And I know, well, obviously Bolaji's been someone who's been really useful for you, but I can understand as well, despite having that sense of community, I'm sure it can be very lonely and anxiety inducing as well, right?
Yeah, no, 100%. And like dealing with sickle cell, it's basically like having 2 personalities, because you have the personality where you have to obviously go for your appointments, medication, all of that, and then you have the other personality where you have to go to school, put on a brave face, act like you're normal, and try and hide that what you're going through, and that's something that I was battling, obviously finding friends, trying to fit in with people, and playing football, being slower than other kids, not knowing why, and trying to fit in, so all of that is, has been challenging, and just finding that balance to try and fit in was quite hard. But like you said, like we discussed, just finding the community of someone who you can actually speak to, it has been a big help. And literally, like the phrase that you said, manning up has been hard, especially when you're 16 years old, you go through that stage where, the world is, you have to take on the world, and, just knowing that, you're not there alone, and you have, support is really important, I would say.
Yeah, I can imagine you in your room, like you said, doing those sit-ups. So, probably making the situation much worse in turn, but unknowingly. So, like you said there, like you were an adolescent, you were juggling so much, like you said, school, sports, wanting to fit in, etc. And I know that when you're at school and when you're that age, it's so... you just want to look like everyone else. You want to just be like everyone else. You don't want to stand out, because I think standing out is seen as such a bad thing. So I just want to, I guess, talk about that. Like you said, you were doing sports and you felt like you weren't able to keep up, perhaps. What was that like for you? Like, did that take joy a bit away from the sports, or did you feel like, I don't know, determined to still play despite that?
Yeah, no, 100%. Like with me, when it comes to, because I love playing sports, especially football, and I would say I was actually good at it, but there were times where I would get extremely out of breath, I feel extremely tired, and then other people are playing, and then they're thinking, what, Mike, what's going on? We've only started, and stuff like that has been really challenging, and then obviously I feel like I can't really speak to them, because they might look down upon me. And I don't know if it's just me, but I don't know if other people go through it. But that has been quite hard. So challenging how to actually fit in with when it comes to playing sports, finding out okay, cool, is this your limit? What you can do and what you can't do. I did find tricky, but I just growing up, I managed to find that sweet spot where I could perform my best, and then cool, I need to come out and take a break, rejuvenate myself, and then come back on. And I feel like it's important to actually know that when you need to take a break, take it, because you need to perform. And just knowing that when you need to take a break is essential, I would say.
Definitely. And Eliane, I'd just love to know, is there something that you've noticed, I guess, like the emotional side? Do you feel like sometimes if someone's feeling just very down and they're struggling emotionally and mentally, have you noticed, or has there been a correlation perhaps between that and how their physical health is as well?
Absolutely. I think there's a correlation between that and how their physical health is, and I think there's a correlation between that and how they're feeling about their physical health and or other parts of their life. So absolutely, our emotions are very much connected to what we do and how we think. And we, maybe if we go back to kind of the manning up comment that we were talking about before, if you're struggling with sickle cell related pain, and then perhaps the way that you're talking to yourself about it is, to man up, you need to get on with this, you need to carry on, or what you do in response to that is to maybe do some push-ups to try and kind of stretch out the pain, ease it out. Those sorts of things are probably going to impact on your emotions in a less favourable way. I think the other thing people sometimes do is they tend to isolate themselves, pull away, maybe go back into their bedroom, maybe connect less with family, connect less with friends, reach out less. Actually what we know makes a difference is reaching out, making those connections, asking for help, saying this is how I feel, showing yourself compassion, showing yourself kindness, the sorts of things you would do for other people we're not necessarily good for doing for ourselves. So if a friend came to you and said, I'm suffering with sickle cell related pain, for example, you might respond to them in a very different way than you might than the conversation you might have with yourself in your head. I'm sure you probably wouldn't say man up, would you? You'd probably say, oh gosh, that sounds terrible. What about a hot water bottle or some water, or what pain meds have you taken, or shall we just sit and watch a film, or whatever you might do. And I think one of the tasks for people living with a long-term health condition like sickle cell is to learn how to have that conversation with yourself, to learn that self-compassion, to apply that, and to show that kindness to ourselves.
So Martin, I'd just love to know, we've spoke about education, we spoke about GCSEs, and I'd just love to know, what's your take on the challenges around studying and pursuing education when you have a condition like sickle cell?
Okay, yeah, it's a common theme. It's important to choose well. You don't want to take a job that requires you to be out in the open in all weathers with no real chance of taking a break, where anytime you are not physically there, you're going to have pay cuts. So it's really important to make sure you choose well. Then once you're at university, obviously you want to choose a university where sickle cell services are easily accessible. So what is maybe your immediate choice from an academic perspective may not be the best choice for you as a whole person, for your holistic care. It's important to choose somewhere that is also within easy reach if you did go through a more difficult time, maybe because of exams. Then there's some very practical things like the accommodation. For instance, some universities have different levels of quality accommodation. Some maybe is more drafty, some have joint bathrooms, some have individualized bathrooms. And there can be little things like not placing yourselves in the bottom of a valley when the university is on top of a mountain, for instance, because these little things can be critical at time of exams. So very often Students will come to us for letters to help with support with these small things. But also importantly, it may take longer before you find your niche, so to speak. So you may set out to study to become a very general person in that field. You might find later that maybe you want to do a top-up degree or subspecialize in something that is particularly suitable for both you as a person and your illness to be able to take breaks. And you just have to allow people more time with that. And sometimes people need little things. Sometimes they need just support and encouragement to take that extra time.
Absolutely. And Bolaji, I'd love to know a bit about your university experience and if the sickle cell services in the area you went to university was something you considered. Did you stay near home? Did you go out?
So university, I went to like a university that was like an hour and a half away from my home. And obviously I talking to my doctors that the general consensus that I was going to come back and forth to then go to my appointment. So I wasn't necessarily transitioning to another hospital. So that was like another factor, obviously trying to find the right university that actually met the needs that in terms of the course that I needed to do. That was another factor. So it was you're balancing all of these discs all at once. And ultimately I kind of went with what was better for me in terms of career rather than health. So obviously it would have been ideal for me to stay in London, stay close to a hospital, but I kind of wanted to not put my health second, but just not let it limit me, should I say? And that was like one of the toughest things I think I needed to make. Like my mum and my uncle were like, "What are you doing? Like you're going too far out." But it was one of those things that ultimately paid off. Almost didn't pay off. I actually had a sickle cell. So within my first 3 months of university, I had a sickle cell crisis that then led to a collapsed lung. That then led to like 2 months in a sedated coma. So it was just one thing after another. And obviously during that whole process, I was like, why did I even make this decision? But you kind of like, as much as you back yourself, you doubt yourself. But you kind of have to, with sickle cell, be brave and make choices that might not pay off. But that's I think that's life. And I think you kind of learn that along your journey. But balancing sickle cell and university was initially challenging, but then it got easier. And that's anything with life, I think. But in terms of the communication with my care, my doctors, in terms of in London and then the university I went to, I think that was probably a transition that needed to be made easier when I went to university, which is probably about 10 years ago. But now I'm hoping that it's not a hurdle that someone has to think about when going to university, because the university, if I'm going to like the University of Oxford, then that can't stop me in my progress in terms of what I'm trying to achieve in life. I think my healthcare needs to be continuous wherever I go within the UK, I'd say.
So we've discussed quite a lot of topics there. We could have gone on several different tangents. I certainly wanted to. I wanted to pick all of your brains, but I just would love to know, for parents listening, what advice would you offer to enable them to support their young person through transition in a way that feels safe?
I would say encourage them to take charge of their own health, encourage them to understand how their condition works, how to look after themselves, the daily things. And to be honest, most of our parents are very good at that. They want to encourage their children to live their best life and help them look after themselves in very simple ways, hydrating, keeping warm, taking medications. And to be honest, the majority of our parents are very good at communicating with schools, ensuring that we provide the school with a school care plan. All of these things are great. I think around the time of transition, we'd encourage them to let go a little bit, step back a bit, encourage advocacy, encourage independence, and just be supportive from the outside rather than taking charge of everything. That's from a pediatric point.
Great. And Martin, would you like to share your final thoughts?
Basically, challenge us. If things are not looking at what you're used to, ask us why. Ask questions, demand better. And there can be simple things that go wrong just by miscommunication. No one is meaning to do you any harm, but we may not realize what else is it we're not providing you with that came naturally before, and now suddenly you're having to ask for things like top-up prescriptions or GP appointments, etc. I just ask us, challenge us, call us. Don't assume we're some kind of untouchable growth-like creatures. It's just really, really important to realize it's an organization and things can go wrong. Really, really important to ask questions as soon as things are not done the way you expected them to, and we should be able to explain to you why things have changed, or maybe it is a mistake.
I think for the parents listening to this, I think you know your children better than anybody. So really think with them, start those conversations, talk things through, troubleshoot, find out what they need, help them to have those conversations, and keep talking, and see it as a process that sometimes you'll be winning at and sometimes it will feel like you're not so much winning at, but generally you're moving in the right direction, and have those conversations.
Brilliant. I'd love to ask Michael and Bolaji, obviously you've gone through this experience yourself. Is there any advice that you would like to give to parents listening that could help make the process a bit more seamless?
Yes, I would say help them by creating a safe space. Allow them to make mistakes, like as Summer said, like booking appointments and taking their meds by themselves and not necessarily pulling all the strings for them. That safe space will allow them to become more independent and allow them to grow, which is the key thing here.
Yeah, 100%. Taking charge, allowing them to take charge of their own health is important, I would say. And, just, communicating with them, letting them know that, they can speak to you about what's going on, and, just obviously being with them through the process, I would say.
So what I've gathered is communication is key, community is very, very important, and self-advocacy is vital, and parents empowering their child to be independent and voice their needs are important steps that can be taken to make the process a bit more seamless. You've been listening to the Sickle Cell Society podcast, and we're supported by Terimo. Stay tuned for next time.